Firstly, thank you very much to the Equity Methods Group for asking me to speak today and talk a little bit about the organisational work we're doing around equity, diversity and inclusion in Cochrane. In some ways, this is really nice how it follows on from what Olivia's just been talking about in the stakeholder involvement in the review process, because this is kind of taking it a bit broader and looking at it across the whole organisation, not just within the way in which we want to involve people in be inclusive in our sort of review teams. So Cochrane launched an initiative to look at diversity and inclusion in the organisation back in October 2021, so October last year. And I'm going to tell you a little bit about the work we've done today. But before I do that, I'm going to talk a little bit about why we've launched this and what we mean by diversity and inclusion in Cochrane. So firstly, so why should we explore this? Why have we gone about this? And I think the best way to look at this from the organisational perspective is to think about what our vision is, which is a world of better health for all people. And that's my emphasis there on the all people. But it's really, really important that if we as an organisation want to benefit more people, then we have to be inclusive. We have to be a global diverse organisation that is diverse and inclusive if we are going to achieve that vision. So from Cochrane's perspective, I don't think of this as we want to be a diverse, inclusive organisation. I think of it as that we need to be a diverse and inclusive organisation if we're going to achieve our vision and mission. Now, the second sort of background point I wanted to talk about is what do we mean by diversity and inclusion? And I included this because this came up a lot when we first started doing some work in this area around about sort of the middle of last year. And we had an advisory group and we talked a lot about what we really meant when we were talking about diversity and inclusion in Cochrane. And we came up with this working definition, which is here on the screen, about empowering anyone to be part of the organisation. And we've said, regardless of these 10 factors, but that list could be longer. It's not necessarily an exhaustive list. But I think what's important here is this illustrates sort of the way in which we were thinking when we put this initiative together. But we're very much seeing this as a working definition that will evolve. And we would expect it to keep evolving over time. But when we talk about diversity and inclusion for the organisation, it really is about making sure that everyone who wants to be part of Cochrane can be part of Cochrane in a meaningful way. So back in last year, we set about what we were terming a listening and learning exercise. And that's what I'm going to spend the rest of the talk talking about in terms of what we've heard through that listening and learning exercise and what we're going to do next. The important thing for me was that when we started this, we didn't want to assume. We wanted to run a diversity initiative. We knew that Cochrane could and should be more diverse and inclusive. And it's very easy to jump to conclusions about the ways in which we could make Cochrane more inclusive, more diverse. And we were really, really explicit at the outset. We're not going to assume anything. We want to start by having a conversation with members of the community to understand people's experiences of engaging with the organisation. How is it from other people's perspectives? And then we'll work up a strategy, a diversity and inclusion strategy for the organisation, which sets out an ambition for how we want to evolve. And I think that was a really important starting point and sort of overriding attitude of how we went about this. So the listening and learning exercise started in October last year and ran through till January this year. And in that time, we heard from 1,312 people. A lot of those we heard from through our survey, which reached over 1,000 people. But we also undertook focus groups and interviews, and we tried to do all of this in as many different languages as we could. As you can see from this slide, on the left-hand side, you can see this chart of the different roles that people held with regards to the people we spoke to. And we were quite pleased with this cross-section. We felt it was a relatively broad spectrum of people we heard from. But importantly, the bottom line, the 22% of people who have no active role in Cochrane, what we were really worried about was that we were going to start this exercise and hear from people who are actively engaged in Cochrane, and so get a biased view of what it's like to engage with the organisation, because we're only hearing from people who've succeeded in sort of making their way inside and developing a role in Cochrane. So we did make an extra effort to try and contact people who have signed up but perhaps not achieved anything yet, or signed up and tried to do things but failed to get involved, and so on. And so we're very pleased we got 22% respondents in that category. We're also pleased with the geographic spread of respondents. We did try to push the exercise in different languages and through different channels around the world to make sure we got a broad representation. And by and large, I think we achieved that. It could be a little bit better in terms of representativeness, but we did get respondents from all over the world. I'm going to give you a link to the full report at the end of the presentation, but I just wanted to pick out a few highlights of things we heard when we spoke to people. And firstly, diversity and inclusion is essential to Cochrane's mission was a message that was repeated repeatedly in the exercise. We heard that from a lot of people, which was great to hear, that people felt that was really essential. It wasn't an extra for the organisation. It had to be embedded in what we do and the way in which we work. So that was really good to hear. 6 out of 10 people, though, said they did not feel as included in Cochrane as they wanted to be. So that was a finding we were that tells us that there are lots of people who do want to engage and don't get as engaged as they could be, or are failing to progress as far and be as included in the organisation as they want to be. And that's something we need to investigate further and understand what the barriers faced were. And when we specifically were talking to those who are not currently involved, they did describe multiple difficulties in getting started in Cochrane, particularly getting in sort of foot in the door, as it were. And so we do want to really understand those barriers. We've collected lots of information from them on this. And we need to look now at how we can try to remove some of those barriers that people found when they were first engaging with the organisation, trying to join Cochrane. Many people who responded did describe Cochrane as too centred around English-speaking contributors, too English-centric as an organisation. And that was a very clear theme that came through. Whether that is in terms of perception that it's easier for people to get involved if they're native English speaking, or whether it's a perception that activities don't happen sufficiently in other languages, or other sort of translated documentation is not available for a sufficient range of outputs that we produce as an organisation. So that was a really important message we received. And similarly, we heard that the leadership, governance and central teams, there was a clear perception that those teams don't represent the global diverse organisation that we are at the moment and what we aspire to be. So there's a call for greater diversity within the teams and groups who are running and leading the organisation. Amongst other things, we also asked people what they recommended we do to increase diversity and inclusion in the organisation. And we got lots of really, really useful feedback from people in this area. And we're really grateful to everyone who contributed to this exercise for all the ideas and the considered views they gave. And I've picked out just a few here, but I could have picked out many more. But the first one here is that we need to recognise the essential nature of diversity and inclusion for Cochrane in achieving its mission, which mirrors the comment on the last page that I mentioned, that people saw it as essential, but they wanted to make sure that we're really reinforcing that message, that it is an essential feature of Cochrane as an organisation, and that needs to be very publicly recognised and acknowledged. There was also feedback that we need to acknowledge that we are not currently as diverse and inclusive as we could be, or as we should be, and that we do need to work to reduce systemic institutional biases in Cochrane. Again, sort of mirroring back to what I said in the last slide, perhaps as an example around linguistic diversity, and the certain biases that people identified in the process that they felt need to be addressed within Cochrane. So there's some very, very important messages in the report around that we need to address in our response. And thirdly, I wanted to single out this point about the way in which we can support people, because that was a common theme in the recommendations people made, that respondents felt that we should be doing more to target and support people from both lower middle income countries and those whose first language is not English, to become more involved, to help them become more involved as either as members and contributors of the organisation or as decision makers in various groups within Cochrane. And that was a repeated message, and it's clearly something we need to pick up. The feedback came in multiple ways. Some of it was talking about providing better mentorship or other support services, or proactively trying to bring more people into certain governance roles, for example. So there are quite a lot of different recommendations around that we can now take forward and consider for the organisation as part of our response. One of the interesting things that I haven't listed here perhaps, but that did come through very clearly both in the feedback people gave us and what they recommended, is that they were thinking about diversity as across the whole organisation, which is really great. So people wanted us to have diversity both in those leading the organisation, those sort of running the organisation, in the contributors producing the reviews, and thinking through diversity and inclusion with regard to those we benefit, making sure we're producing a wide range of reviews that meet the needs of all different people across the world. So people did think it was, when they were saying that diversity and inclusion is essential for Cochrane, they were very much saying that in the broadest sense possible, which whilst that makes it a very significant challenge for the organisation, I think that's really important that we do think of it across all different levels within Cochrane. So what happens next? Well, as I say here, what happens next really matters. And I say that seriously because we've had a lot of very personal feedback from people throughout this process. Some very personal reflections on the way in which they've experienced interacting with our organisation, and they've given us many good ideas about how we could evolve, how we could be better. And so we need to change it in response to that. So what are we going to do? Well, we've published the report as of this week. And And so that is now available for everyone to read. And you're very welcome to get in touch with me if you have any comments once you've read that report. But now we're going to be starting to move to a sort of strategy and action plan in response to the report. So we've already got a great starting point with the recommendations that people made, but we now need to translate that into an action plan, what we can do, and identify some priority areas for early action. It's not going to be a one-off, we're going to do some work in this and then that's the end. This will be it's very much a journey. We need to, we can't fix everything overnight. We need to identify the most important areas of work that we need to focus on. And we'll be doing that in the strategy by prioritizing a small number of initial goals that we can achieve in the short to medium term that are measurable and will make us, allow us to achieve some progress towards improving the situation in Cochrane. But importantly, we also have to think of that longer term. So I put here 2023 onwards, because a lot of what we're talking about here and a lot of the recommendations that came from people amount to culture change, changes in ways of working as an organization. So some of these changes will need to be embedded in future strategies for the organization, future culture, ways of working. And in many ways, diversity and inclusion needs to be not seen as, or certainly shouldn't be seen as a separate initiative in the long term. It should just be seen as a key factor to the way in which we work as an organization. So that's where we are at the moment. We will post more information about the development of that sort of strategy or action plan over the coming months. And we will be welcoming input through that process as well as basing it on the listening and learning exercise, of course. And this report that I've been sort of describing today is available on the Cochrane website now. It's on Cochrane.org, and you just need to navigate to the About Us tab at the top of Cochrane.org, and you'll see then in the left-hand menu the Cochrane Diversity and Inclusion, and that leads you to the report. That can be read there in full, along with an introduction from the programme board that oversaw this work, which is myself and Tracy Howe and Juan Franco from the governing board and Sylvia Manozzi from the Cochrane Council. And in that introduction, we've outlined some of what we feel are our initial thoughts on areas of priority, which will go into the strategy process, but is very much our initial views. It's not definitive. And also you'll see at the bottom of the screen, in that screenshot, we've translated the summary of the report and the introduction into multiple languages to try to improve the accessibility of this report. So that is all now available on the Cochrane website. And that's the end of my presentation. So now I'll be happy to take some questions.
Wonderful. Thanks, Chris, for that presentation. It's good to see the results being presented after having taken part in the survey. And I know many people who are interested in providing their input as well. So we have a comment from Damilola Iduye. My suggestion for the definition of diversity and inclusion is to also include ethnicity, which better captures cultural identity and expression. I believe that is just a comment, except if you wanted to say something to that effect, Chris.
Yes, I would. I think that's a really helpful comment. Thank you. And it is, that definition was very hard to put together, and we very much saw that as a working definition. But that's a very helpful comment that we'll take on board to improve that definition as we go. Thank you very much for that, Damilola.
Okay, we have another question from Dario. Chris, you've highlighted feedback on where Cochrane could be better in terms of inclusion and diversity. Did your listening and learning exercise highlight any areas where Cochrane is already doing well in this regard?
Yes, it did. We very much actually set out to investigate what both the barriers and enablers are of diversity and inclusion in Cochrane. So we did capture what's going well, and actually there are lots of good things, and perhaps I have focused more on where we need to improve today. But there are sections in the report that do highlight what we're doing well, and we did as well as some of the survey work, we also did some data collection from our systems to look at current spread of sort of diversity on, for example, within the governing board and other governance structures, and found some positive messages there. In all cases, we know that there's always room for improvement, but there were also some good news stories there as well, in terms of we are already very very diverse and inclusive in many areas of the organisation. So I think this should be treated as I don't want to suggest that it's all negative for the organisation. I think there's a lot of positive news in the report about how well we are doing at the moment, but we have equally tried to keep a focus on where we can improve, because we are very keen not to show this as a way of we're saying it's all good news, we don't need to take action. We want to focus on the fact that we are absolutely committed to improving things, and that's why we've tried to keep the focus on where we need to improve. But that is a good reminder that there was positive feedback in the report as well.
Thanks, Chris. You did touch on this in your presentation, but will there be opportunities for the Cochrane community to contribute to the development of the strategic action plan?
Yes, there will be. And I haven't got any specific guidance on how people can contribute at this point. We're not quite at that stage yet, but I will post probably on that Cochrane diversity page, and try and communicate as widely as possible once we've set up a process for that, because I would value community input, both in the sort of team developing that. I think it's very important that it's not just sort of centrally developed. We need lots of people involved in that process, but also getting further ideas in from the community and reviewing the draft strategy with the community as well. So there'll be multiple opportunities for people, and we'll communicate as soon as we know more on that.
Okay, thank you. We'll take two last questions, one for you and one for the rest of the group. Vivian is asking if the report mentioned assessing equity within reviews. For example, the Mercer equity.
The report does talk a little bit about our content. It doesn't go into detail about sort of Messier equity or anything specific like that, but people, there was well, I guess two messages. One, that to be a diverse and inclusive organisation, and we need to produce a more diverse range of evidence products if we're going to meet all the needs of people across the globe. And also that we need to ensure that at all levels, both in terms of the reviews we choose to work on and the people we choose to work with on those reviews, we need diversity and inclusion at all levels there, if we are to be a global diverse organisation. So yes, it did come up, and it is mentioned in the report, but it doesn't go down to quite that level of detail around the Messier equity.